Hello, dear students. The task of our present lecture is sexually transmitted disease. Also, we will discuss modern approach to a diagnosis and treatment of these pathologies. What can we say about sexually transmitted disease? This is a group of infectious diseases transmitted through unprotected sexual intercourse and causing various pathological changes in the reproductive organs and in the body as whole. At the present, there are more than 25 different types of infections that are transmitted sexually. Today, 75% of the adult population are carriers of different kinds of STIs, while many do not know about it. And that means that a lot of cases of sexual transmitted infection have a symptomatic course. And this is very dangerous because at the present time, all over the world, sexually transmitted infections are one of the leading causes for the infertility. Over the past 35 years, according to some sources, the increase in the number of registered cases of STIs is up to 200% per year. Moreover, this increase occurs faster in women than in men, reaching the maximum values in the age group 20 to 29 years old, which is in the future will certainly have a serious impact on the reproductive health of the nation as well. The features of the modern STIs is an erased clinical manifestation and a prolonged recurrent duration of the disease, and mostly the cause for this erased clinical manifestation is wide use of different antibiotics and sometimes incorrect use of these antibiotics that would lead to the pathomorphosis of different these infections transmitted sexually and to erased clinical manifestation that make these infections more dangerous. The main causes for rapid spread of STIs are changes in the norm of sexual behavior, rejection of barrier methods of contraception, and low levels of social, economic, and educational development of the population. What can we say about the epidemiology of sexually transmitted infections? More than 1 million contaminations by STIs occur every day worldwide. An estimated 376 million new cases of one of the four main STIs, such as chlamydia, gonorrhea, syphilis, and trichomoniasis, occur annually. More than 500 million people are estimated to have genital herpes caused by herpes simplex virus, and more than 290 million women have papillomavirus infection. And we know that the papillomavirus is the main cause for the cervical cancer, and the incidence of cervical cancer increases annually all over the world. And despite the wide range of screening methods and the known pathogen that cause the cervical cancer, but worldwide spread of papillomavirus infection cause the increased incidence of cervical cancer. In 2016, about 998,000 pregnant women were infected with syphilis, and this results in over 20,000 stillbirths and deaths of newborn. And as you see, sexually transmitted infections are very actual problem of the modern gynecology. And let's have a look to the epidemiology of sexual transmitted infection, and we can see this world map. And all the continents are colored with different colors, and we can see the distribution and the incidence of main types of sexually transmitted infection in these continents. And let's start with the North and South America. And in these two continents, according to the World Health Organization data, we can see that there is a high incidence of chlamydia and trichomoniasis, a little bit less we can face with gonorrhea and syphilis. In Africa, very high rate of trichomoniasis, and it's counted about the 37%. Then chlamydia and gonorrhea and incidence of syphilis is a little bit lower. In the Eastern Mediterranean region, also increasing rate of trichomoniasis and chlamydia. In Europe, the incidence of sexually transmitted infections less than in previous regions, and also the high incidence of chlamydia. Instead, incidence of trichomoniasis is less, and we see that the incidence of syphilis also is very low. And in Southeast Asia, almost the same rate of chlamydia and trichomoniasis, and in the Western Pacific region, very high incidence of chlamydia, trichomoniasis, and gonorrhea. Here we can see on this slide, we can see the main pathogens that cause the different sexual transmitted infections: human papillomavirus, herpes simplex virus, human immunodeficiency virus, chlamydia, Neisseria gonorrhea, Treponema pallidum that cause the syphilis, Urea plasma urealyticum, Candida albicans, and Trichomonas vaginalis. These are the main common sexually transmitted infections that affect the sexually active people during the different periods of their life. Let's have a look and have a small trip to the history of sexually transmitted infection, and we know that despite the fact that sexually transmitted disease have been known for more than 1 century, they began to be effectively treated relatively recently, in the second half of the 20th century. Prior to this, the unfortunate suffering from this bad disease, as people call this disease, this group of disease, at the ancient time, the Aesculapians used the most strange and barbaric methods of treatment of this disease. And such treatment not only did not contribute to the cure, but on the contrary, crippled the patient and was very serious menace to the life of these people. Nevertheless, many ancient civilizations possessed a sufficient level of medical knowledge to correctly diagnose disease and understand their natural well. On one of the most famous written monuments of ancient Egypt, the Ebers Papyrus, we can see the healers performing some manipulations with the patient in the groin area. And this way of dealing with venereal disease was not the only among the Egyptians. They actively performed rituals with spells to drive out weak evil spirits, and also used all kinds of mystical drugs, ointments, and lapping made from the herbs and different minerals mixed with the crushed cow horn and garlic. We also have information from the ancient Greece or from the ancient Rome Empire and the Middle Ages, and medical historians believe that the ancient slides were well aware of the nature of the spread of sexual transmitted infection. Therefore, information has come down to us about how to protect against such a disease. So they not only treated this disease, also they knew the methods of protection against this disease. Before the sexual act, the inhabitants of Hellas, it's in ancient Greece, washed themselves thoroughly, after which they rubbed the perineum with various oils. And they thought that these oils would protect them from this sexually transmitted infection. And it's interesting fact that in ancient Greece, they knew about the sexual transmitted infection, that infection they passed through the sexual intercourse, and that's why they rub these perineal area or inguinal area. But if the disease could not be avoided, which is generally is not surprising, with this method of protection, when the treatment was practiced simple and radical, the famous physician Soranus of Ephesus prescribed lead weights to his patients with gonorrhea. Let's go to the Middle Ages. And at the Middle Age, one of the most popular methods of treatment was the mercury. It was especially often used to treat sexually transmitted disease. One of the founders of the modern medicine, the Swiss physician and alchemist Paracelsus, strongly recommended mercury ointments for external use. Most often, mercury ointments was rubbed into the legs, which significantly shortened the patient's life and in general lead to a decrease of the number of STIs. But along with the decreasing the incidence of STIs, it of course leads to the patient's mortality, increasing the patient mortality. Most of STIs treatments were intimidating largely due to the lack of anesthesia and antibiotics in the Middle Age. So the doctor offered syphilis patient treatment with leeches, which should suck out all the infected blood from the body, or they recommend profuse bloodletting. Here we can see in this picture the bloodletting in the patient. Also, we can see usage of mercury, and they rub the mercury into the lower extremities of the patients. At the end of the 17th century and the beginning of the 18th century, a simple and harmonious system for treating venereal disease was invented in France. It consisted of three very, very simple stages. First, the patient was publicly flogged in the town square. After that, the patient was sent to the hospital where he was examined, and if the disease was not too advanced, the treatment began. So they start, put the patient inside the chamber or something else, or a wooden space, and keep the patient there before, as they estimated, the treatment finished. And the patient underwent bloodletting, gastric lavage, and then prescribed water procedures. And the unfortunate person was bathed in a cold water for 2 weeks, and then goodbye. They did another gastric lavage. After that, good old mercury was used. The patient was rubbed with ointment with this metal. After all this bullying, it was believed that the medical science did everything possible to heal, and the patient was put out of the clinic's doors regardless of the result of therapy. What about England, especially in the 18th and 19th century, they also knew that the sexually transmitted infections pass through the sexual partners, and especially they blame the prostitutes in the spreading of this infection. And there was very great disaster and very catastrophic practice. They stopped each woman on the street, suspicious woman, take off her clothes, and if they found something looks like sexual transmitted symptoms of sexual transmitted infection, they just put this woman to prison for a long period of time. But for the present moment, we are very happy that we have the great advantages of diagnosis of sexual transmitted infection, timely diagnosis, and a lot of medicines for and sources for the treatment and successful treatment of these infections. Let's start with the anatomy of female reproductive organs. We will discuss the external genitals, and we know that the external female genital organs consisted by the labia major, labia minor, vulva, anal sphincter, urethral opening, and clitoris. Also mons pubis, and this is perineum. And usually sexual transmitted infections start in this area. They cause mostly vulvovaginitis and cervicitis. After that, depending on the infection, if they have tropism to the cylindric epithelium, they may ascend through the cervical canal and the uterine cavity to the up to the fallopian tubes and then to the abdominal cavity, even causing pelvic inflammatory disease. And let's talk about the physiology of the vagina, because it's very, very important. And the vagina as the organ, it has its own biostenosis and its own environment, and which has the protective functions. And the secretion of alkaline transudate from the vaginal epithelium and cervical glands maintains a human pH in the range of 3.8 to 4.5. If the normal pH of the blood is about 7.5, so the vaginal environment is 3.8, 4.5. That means that vaginal environment is acidic. In addition, the vagina and its macrobiostenosis form a unique balanced environment that can change under the influence of the external stimuli. The vaginal epithelium consists of 3 layers of cells: surface cells, intermediate, and basal cells. These cells are able to accumulate glycogen under the influence of estrogen, and they establish the normal structure of the vaginal stratified squamous epithelium. During reproductive period, the bacterial flora of the vagina is presented by the numerous microorganisms, including aerobic and anaerobic gram-positive and gram-negative bacteria. Lactobacillus and Corynebacterium are prevailing in the amount, and they produce lactic acid, and this lactic acid also sustains the vaginal environment acidic, and they help to protect the vagina against different pathogens. Lactobacillus and also they produce vinegar acid from the glycogen, and thus also establish low pH of the vagina. If reduce the number of bacteria, it will open up ecological space for candida and other microorganisms to grow and flourish. What are the main complaints of patients with sexually transmitted infection? First of all, it's pathological discharge from the vagina. The character of discharge and the amount of this discharge may vary depending on the pathogens, and each of the pathogen had its specific kind of discharge. some with the scant amount or excessive amount, with smell or without any smell. And they are different, and it's one of the characteristic for the differential diagnosis. Burning and itching of the external genitals, whites, dyspareunia. Dyspareunia, it's a painful sexual contact, and infertility. These are the main complaints of the patient with STIs that admitted to the hospital. Also, pelvic pain, failure of urination. Let's start to study different sexually transmitted infections. Let's start with the most common infection. It's the vaginal candidiasis. What is this? The causative agent of vaginal candidiasis is the microscopic yeast-like fungus belonging to the kind of Candida. In 80–90% of cases, it's caused by Candida albicans, though there are more than 20 types of this fungus exist. And the second common type is Candida glabrata, but mostly the clinical symptoms of all these yeast almost similar. Candida is a conditional pathogenic fungus that normally lives in the human body. It lives in the saprophyte condition, but in the low resistance or in the state of immunosuppression, they become pathogenic. Natural suppression of the activity of the fungi is provided by the physiological activity of the lacta and carinobacteria, and with a decreasing amount of this bacteria in the vagina, leads to the development of the pathogenic activity of different microbes, including Candida albicans. They become pathogenic in the state of immunosuppression and under the influence of external exposure. Characteristic sign of the Candida is dense white discharge looking like cottage cheese. Also, treatment with antibiotics and pregnancy, UV exposure, chemotherapy increase the incidence of vaginal candidiasis. Vaginal candidiasis mostly has a chronic course. Exacerbation episodes occur several times in 70–75% of women of reproductive age, and these are one of the most frequent reasons for visiting a gynecologist. The symptoms of vulvovaginal candidiasis is the excessive amount of white cottage cheese-like discharge. You can see on this picture the kind of discharge at vulvovaginal candidiasis, and sometimes in severe condition they just implant to the wall of the vagina, and when we try to detach these formations from the wall of vagina, it's very easily bleeds. Itching, discomfort in genitals, dyspareunia and problems of urination, hyperemia and edema of the vaginal mucosa. These symptoms are common almost for all the sexual transmitted infections, but as I told you, each of these infections, they are specific discharge, and the main characteristic of vulvovaginal candidiasis is the cottage cheese-like firm white discharge. Treatment of vulvovaginal candidiasis, usually we use antifungals and antimicrobial agents. In some cases, we use antibiotics, corticosteroids for complex therapies necessary, and local douching, depending on the course of the disease, if it's the initial activation of disease or it's a chronic stage. So it depends on the course of this disease. And let's have a look what kind of medicines we use for the treatment of vulvovaginal candidiasis, and we use for the treatment different groups of antifungals such as butoconazole as the vaginal cream. We can use in different types. We can use suppositories, vaginal creams, or vaginal tablets, and pessaries. For example, clotrimazole is one of the most common medical agents for the treatment of vulvovaginal candidiasis. Also, we use the antimycotic capsules. For example, widely used fluconazole, and but usually we use local administer the local treatment of the vulvovaginal candidiasis, and it is very beneficial. These are the main medication that we use in the treatment of vulvovaginal candidiasis, dosage, and comments. Next disease, it's a trichomonas. The causative agent of the trichomonas is the protozoa Trichomonas gondii. Infection affects vaginal mucosa, urethra, and leads to development of other urogenital disease such as Bartholinitis, urethritis, vulvovaginitis, and cervicitis. Approximately 70% of patients have a symptomatic course of the disease. With an increase in the level of acidity of the vagina, they pass into the amoeba form and then freeze without demonstrating any symptoms. And this is a very dangerous condition because these protozoas may persist inside the vagina for a very long period of time and activates as any condition of immunosuppression. During menstruation, as well as during the pregnancy, trichomonas start active process of reproduction because during these periods, pH of the vagina increases and it's become more alkaline. Trichomonas mostly affects women. There are several types of forms of the disease. First, it's a fresh that lasts not more than 2 months. Chronic that lasts more than 2 months and has poor symptom manifestation. And career patients, they can be only diagnosed only during the laboratory test, and these patients have no symptoms at all. And we can see these trichomonas, they are monocell parasites containing the nucleus, and they have the special strings that help them for the moving, especially in the wet mount. Clinical signs of trichomonas, it's excessive greenish or yellow vaginal discharge with bad smell, frequent desired urination, pain and burning while urination, edema and itching of the vulva, dyspareunia, pain in the lower abdomen, minor scratches and ulcers of the perineum. At speculum examination, cervix is edematous with many small vascular elements, and this cervix, it has the appearance of the strawberry, and it's one of the characteristic signs for the trichomonas, strawberry cervix, and signs of stomatitis and glossitis in the case of the oral sexual contacts. Treatment of trichomoniasis. We use metronidazole, tinidazole, clindamycin, and in different dosages. It depends on the form and type of the disease, and sometimes we use just a single dose of metronidazole, or if it's required, we made the month or week, 7 day of treatment, or several courses of treatment, especially if it has the asymptomatic duration or amoeba form. Chlamydia. Chlamydia at the present time is the most common and worldwide spread sexually transmitted infection. The causative agent of chlamydia is intracellular obligate parasite Chlamydia trachomatis. Chlamydia differs with its asymptomatic duration. It is very dangerous because it affects upper genitalia, and that's why chlamydia is the very silent aggressor. It's one of the main etiological factors of the tubal peritoneal type of infertility. 2/3 of all cases spread among young people, so average age of affected is 15 to 24 years. An estimated 1 of 20 sexually active women are carriers of chlamydia. Afro-Americans are 5 to 6 times more prone to chlamydia, and that's why the incidence of chlamydia in the African continent is higher than in other regions. Chlamydia has very interesting life cycle, and as we can see, exactly after contamination with the chlamydia, it enters the body organism, human organism as elementary body, and it attached to the cell and enters to the cytoplasm of the cell, because we know that the chlamydia is the obligate intracellular parasite. During the 12 hours, elementary body transforms into reticular body. Here we can see reticular body inside the cell. After that, during the 20 hours, this reticular body prone to replication and to increasing in the amount. At the 30 hours, we see many reticular bodies inside the one cells. After that, the cell is ruptured and elementary bodies, they release from the cell and spread into the intercellular space, and after that they affect the next cell. This is circulation and the lifespan of the chlamydia inside the human organism, and that's why it's very dangerous, because we can treat it, and the antibiotics may affect chlamydia only in the stage when the releasing of these reticular elementary bodies from the cell, because when the chlamydia is inside the cell, it's not sensitive to the treatment with antibiotics. What are the symptoms of chlamydia? Chlamydia is a silent parasite. Only 10% of men and 5 to 30% of women have symptoms such as cervicitis, urethritis, pelvic inflammatory disease, and pharyngitis. Diagnosis of the chlamydia is not difficult. Usually it's amplification of the nucleic acids or polymerase chain reaction from the vaginal and urethral smears. Also, we can make the identification of the viral culture or immunoferment analysis of the blood serum on detection of immunoglobulins M and G. And treatment of the chlamydia, usually we use several schemes for the treatment, and there are the medicines of the first choice, antibiotics of the first choice, and alternatives. The antibiotics of the first choice are azithromycin, erythromycin, and the alternatives are doxycycline, amoxicillin, and azithromycin by the different scheme of treatment. Bacterial vaginosis is the most common infection among women of age 15-44 years old. Bacterial vaginosis is linked with disbalance between good and bad bacteria of the vagina. It's not the kind of sexually transmitted infection because bacterial vaginosis usually caused by the microbe association mostly with the Gardnerella vaginalis that exist in the vagina in saprophyte condition and cause the infection in the low immune resistance of the organism, and in case of increasing of the pH of the vagina and decreasing the amount of lacto and corynebacteria. And usually bacterial vaginosis develops along with other sexually transmitted infections. The main causative agent of bacterial vaginosis is Gardnerella vaginalis. Presence and exacerbation of bacterial vaginosis during the pregnancy may lead to early spontaneous labor and pregnancy loss. At the non-pregnant state, bacterial vaginosis is not so serious infection, but it becomes very serious during the pregnancy because it is one of the causes for the premature birth. And bacterial vaginosis increases incidence of other sexually transmitted infections. And here we can see the difference in these clinical symptoms and the differential diagnosis between the bacterial vaginosis, candidiasis, and trichomoniasis. And causative agents, they are different in the bacterial vaginosis caused by the Candida albicans or Candida glabrata, sexual trichomoniasis by the Trichomonas gondii, and the bacterial vaginosis caused by the different association of microbes, but mostly Gardnerella vaginalis. Bacterial vaginosis characterized with the presence of the very bad odor. It's like odor smell of the spoiled fish, and that's why we call it fishy or musty, unpleasant odor. Candidiasis does not have any odor, and trichomoniasis sometimes the fishy odor presents. Vaginal itching and irritation only in mild degree presented in bacterial vaginosis. Vaginal candidiasis usually followed by the excessive itching and burning and irritation of the vulva and vagina, and trichomoniasis also it's presented and pronounced. Also, additional symptoms such as dyspareunia and dysuria and lower abdominal pain presented in these two infections. The character of the vaginal discharge also differs. In bacterial vaginosis, it's a thin, milky, white or gray, but in vulvovaginal candidiasis, the character of the discharge is the cottage cheese-like, thick, and white, and these are it's firm. In trichomoniasis, the discharge is excessive, it's frothy, yellow-green. Signs: the discharge coating vagina and vestibular, no vulvar inflammation and bacterial vaginosis. In candidiasis, normal findings of vulvar erythema, edema, fissuring satellite lesions, and affection of vulvovagina or vulvitis and vaginitis, or so-called strawberry cervix. It's a characteristic signs for the trichomoniasis vaginalis. Symptoms: white or gray watery discharge from the vagina, pain itching, burning of the vagina, strong fishy odor, especially after sexual intercourse, and this odor, the smell is um, very excessive and may be sensed by the partners or by woman or herself. Burning during urination and pelvic inflammatory disease. Diagnosis. For correct diagnosis, there should be at least 3 of the following criteria: grayish discharge, vaginal pH more than 5, fishy odor, especially kali potassium test, and microscopic finding of clue cells. If 3 of these 4 criteria exist, we can easily make the diagnosis of bacterial vaginosis. Treatment of the bacterial vaginosis: recommended treatment with metronidazole or clindamycin as the vaginal application. Also, alternative treatment by tinidazole, clindamycin, and different suppositories containing metronidazole and antibiotics. Next pathogen is the herpes simplex. Causative agent of herpes simplex is the virus type 1 and herpes simplex virus type 2. More than 1 of 6 persons aged 14 to 49 years are carriers of the herpes simplex virus. Herpes simplex virus enters human body through the skin and the mucosa. Danger of this disease is included in its asymptomatic course. An estimated frequency of the disease worldwide is about 70 to 85%, and it has a recurrent course. Incidence of contamination at protected sex is about 7.5%. More than 40% are responsible for spreading infection because of asymptomatic duration of the disease. Which are the ways of contamination? First of all, initial contamination by oral dropway. Secondary contamination by sexual contact. Transplacental way of contamination during the pregnancy and labor. The vast majority of viruses may concentrate in the uterus and in the cervical canal, and that's why if there is a generalized form of herpetic infection or herpes in the acute stage or exacerbation of herpetic infection, especially type 2, the vaginal birth is contraindicated because there is a high incidence of contamination of the fetus. And that's why I recommend cesarean delivery. Household route of transmission. At certain conditions, virus may live in surrounding environment for several hours. And next way, it's a self-transmission of the virus from the other part of the body. For example, patient may transport viral particles from the oral cavity to genital mucosa and opposite. Pathophysiology of the herpes: significant neurovirulence. Immune system cannot resist entrance of the virus into the cells of the body. Latency: herpes localized inside the nerve ganglia close to the gate of infection and has no symptoms during some period of time. It's prone to reactivation. Re-replication may occur even after long-term remission. Exacerbation may develop at fever, trauma, stress, menstruation, and different exposures. Initial infection by herpes simplex virus 1 and herpes simplex virus 2 characterizes with generalized clinical manifestation and high rate of complications. Recurrent herpes simplex virus characterized by moderate clinical symptoms and remissions. Clinical symptoms are the hyperemia of the skin and mucosa, appearance of small ulcers and vesicles on the skin, like this, you can see. These vesicles and ulcers appear on the vulvar area also. It may have this appearance. Chilling, fever, myalgia, especially these generalized symptoms, they exist at the initial contamination by this virus. Vaginal or penile discharge, enlargement of the lymph nodes, especially regional lymph nodes. Usually these are inguinal lymph nodes or lymph nodes that are close to the gate of infection. Itching of the contaminated area, sometimes they are very, very painful and cause discomfort to the patient. Edema of the mucosa and painful urination, especially if the location of this vesicle close to urethra. Recurrences. Recurrent episodes may be evident in 50 to 75% of patients. Periods of remission may last for several months. Severe duration of the disease characterized by frequent recurrences. Vesicles sometimes may persist during 5 to 8 days, but sometimes they may last till 2 weeks. Diagnosis of the herpes is not difficult. The collection of contaminated biological material, a smear is carried out in the area of the urethra, vagina, and cervix. Also, we can see the vesicles, and these vesicles have the very characteristic appearance for the herpes. Cultivation of the virus on tissue culture of identification of the pathogen using an electron microscope. PCR or polymerase chain reaction, it's a high precision method for detecting viral DNA in a patient's body. Using PCR, specialists also determine the specific genotype of the pathogen. Blood test with the subsequent determination of the herpes simplex virus type 1 and 2 antibodies. It's the immunoglobulin G and M, and they are detected by the immunoferment analysis. This test helps to find out latent infection or previously past infection. Immunofluorescence is one of the methods of virus type identification, and this type of analysis helps to identify viral antigens. What are the treatment options for the herpes simplex? At the first episode, we use valacyclovir or acyclovir in the special dosage during the 5 days, or famciclovir during 5 days, and these medications can be used in pregnancy and but after 28 weeks of gestation. And recurrent episodes, we use the treatment by valacyclovir 500 milligrams twice a daily during 3 weeks, or acyclovir and famciclovir during 3 days or 1 day additionally. Next infection, it's a human papillomavirus, is one of the most common viral infections of the genital tract, and vast majority of sexually active men and women may be infected by human papillomavirus, some of them several times during the life. There are more than 200 types of human papillomavirus. 14 of them are highly oncogenic. And these viruses, they increase the oncogenic risk for the development of cervical cancer or laryngeal cancer. Some types of human papillomavirus are causes for cervical cancer. In 70% of cases, cervical cancer develops as a result of 2 types of human papillomavirus, mostly 16 and 18 types. Cervical cancer is the second most common type of genital cancer, and estimated in 2018, the number of women with initial diagnosis of cervical cancer was 570,000. In 2018, about 311,000 died from cervical cancer. So 85% of cases were noticed in the countries with low social economic status. Some non-oncogenic types of human papillomavirus, especially type 6 and 11, are causes for different skin condylomas and papillomatosis. What are the risk factors for human papillomavirus? It's first of all its degree of oncogenicity, impairment of immune system. Patients with immunosuppression, particularly patients with AIDS, are more prone to human papillomavirus, especially of oncogenic types. Chronic disease, other STIs such as chlamydia, gonorrhea, syphilis, number of labors and early pregnancies, smoking, and also early onset of sexual life and great amount of sexual partners. Infection by the human papillomavirus, it infects epithelial cells in the cervical mucosa and integrates into the cellular genome with causing cancer. And it starts with contamination and destruction of the lower parts of the epithelial surface of the cervix and affect the basal layer. After that, these abnormal cells start to divide and they replace the normal cells of the stratified squamous epithelium of the ectocervix and leads to the damage of all the epithelial layer of the cervical ectocervix. And we can see here very clearly the process of contamination, damaging, and increasing the amount of these abnormal cells and total replacement with the damaging of the basal layer and surface epithelium. And all the epithelium along the thickness is destructed. Symptoms of human papillomavirus. Development of the condylomas at different size and shape. Here we can see skin condylomas. Pointed papillomas of the anogenital region are usually soft and have abundant vascularization. There are lymphatic infiltration in the pedunculus. Genital papillomas are often multiple and tend to grow and rapid dissemination during pregnancy and cervical inflammatory conditions. Cervical impairment of different degree, and we can find out the impairment of the cervix at the cytology of the cervix or pap smear test that included to the screening program because of the cervical pathology. And also we can find out the changes, visual changes during the colposcopy. This is infection of the cervix by the human papillomavirus and the progress of the stages from the contamination to the invasion and development of the cervical cancer. Diagnosis of human papillomavirus is made by the laboratory test using polymerase chain reactions with type-specific and species-specific primers. This method allows the detection of viral genomes, including the viral sequences in the genome of cervical tumor cells in 95 to 100% of cases. Treatment of the human papillomavirus, it's not specific, and there is no specific treatment of human papillomavirus at all. Elimination of the affected area is performed by physical and chemical methods. If we find out any symptoms of human papillomavirus, it's mostly the cervical processes like dysplasia or flat condylomas. or it's maybe the exophyte and condylomas and papillomatous of the derma or skin. And we can remove these pathological areas by the special methods. It's maybe cryotherapy or using of different chemicals or carbon dioxide laser vaporization or electric incision, different types of the treatment options. The pathology of the cervix is treated by the conization, vaporization, cryo and radiofrequency exposure and carbon dioxide laser. The method of choice in treatment of severe dysplasia is amputation of the cervix or hysterectomy. It's indicated to patients with SIND3, and in carcinoma in situ, we recommend hysterectomy and Wertheim operation in case of cervical cancer, and no specific treatment by immunomodulators in some cases. And don't forget that the safety is more important than convenience. Thank you for attention.